Here in Malta, like several other EU countries, we have actually seen an increase in antibiotic prescribing within hospitals during the COVID-19 pandemic, which is of course paradoxical because this is a viral infection. However, it mirrors what has been reported in the literature with systematic reviews showing that up to 70% of hospitalized COVID patients received antibiotics, even though the instances of bacterial co-infections were in the region of around 3 to 4%, and bacterial secondary infections were only in the region of 15%. Inappropriate antibiotic prescribing is driven especially by behavioral factors, including culture, and that a significant proportion of antibiotics are prescribed mainly to address clinical uncertainty on the side of the prescriber or the patient. So confronted with an infection such as COVID-19 with a high morbidity and a high mortality and the relative lack of therapeutic options, I don't think it's a surprise from a behavioral perspective to see antibiotics used mainly to address this clinical uncertainty rather than the infection itself. Addressing the future, in my opinion, requires looking to the past. In other words, continuing what we have been doing in terms of antibiotic stewardship through multimodal interventions, addressing attitudes and knowledge, through training, through educational tools, improving motivation to prescribe better, using positive as well as negative motivators, as well as looking at our systems and see if we can improve our systems, such as, for example, introducing expert gatekeeping. There's no magic bullet, but these interventions have been shown to work and they can make a difference. We cannot afford to misuse antibiotics, even when faced with a challenge, and it has been a challenge, such as COVID-19, because if we misuse them, as we've seen again in clinical cases of outbreaks of multi-drug resistant organisms, if we misuse our antibiotics, the end result will be this ever-increasing spiral of antibiotic resistance with the difficulties it brings in providing effective care to our patients.